where do people get stuck in pain recovery? That's today's topic.
It's a great topic, Les. And for those who don't know me, I was in one of the previous videos. I work with Les on a pain recovery program called Remedy, and we work together on helping people answer that question and get unstuck and move forward with the recovery process.
Mhm.
Les, you're the expert in this. There are 50 million people plus out there who struggle with chronic pain, from migraines to back pain to knee pain. Is it possible for them to recover? And what's the latest science say about this?
The latest science says it's possible to recover. However, a lot of people get confused between acute pain and chronic pain. Acute pain, when it happens, it has a timeline when the body heals and people go about their life. But when it comes to chronic pain, and it's often mistaken for when people are in chronic pain, it means it's greater than 6 months. And you know if you have chronic pain or not, because it impairs every ripple of your domain life, like your life. Every single domain is impacted. And very often people get pain flare-ups, which means higher than your average, where it really shuts you down to the point where sometimes you cannot move and you're missing work, to the point where you feel more depression and anxiety and even anger because you cannot seem to get rid of this pain, and you're just sick and tired of being sick of this damn pain, right? That's a flare-up, and often people think that's acute. But so there's a timeline. So what we do need to know is acute pain is less than 6 months and chronic pain is greater than 6 months. It's a simple way to look at it. And sometimes when you're in chronic pain, those of us who've experienced it, like us and many of our members here, have experienced a heightened level of intensity for 1 to 14 consecutive days. Yes, it can be 15 and 16 days. And very often, most people, they may not realize that there's an emotional component. So whether it's acute pain or chronic pain, now that we've discovered the timeline, one is 6 months and less, one is greater than 6 months. But what's really interesting about both of them is emotions play a role in both of them. So whether you slammed your thumb on the car door, you're going to have an emotion there. When you have chronic pain, things get processed a little bit differently. It's more experienced with a heightened level of emotions. And so, for example, when you're feeling day-to-day chronic pain, as most of us know what that feels like, is it wears and tears on you. It's draining. And it's no wonder where people that I work with who are trying to heal get very angry and sometimes display that anger. And sometimes if they don't display the anger, they sort of go inward, and that turns into sort of depression or fear.
Yeah, it truly feels like, and a lot of people use the word, I feel stuck
Mm.
in chronic pain. They've maybe made this transition from acute to chronic. Um, what are the four stages of you just mentioned that people tend to get stuck, and then you've identified kind of four stages of people taking to get out of this.
Yeah. Yeah, the four stages, the first stage is basically belief. I have a silly saying, maybe it makes sense, is that your relief is in the belief. If you believe that the reason you have your chronic pain is due to structure, nerves, or tissue, and all three, then you're kind of at the mercy of those who are trying to treat you. The question you really want to ask in this moment before we go through the other three is this: is what you're doing getting you the life that you want? How much money have you spent? How much time have you spent? And what we do know is this is the latest science, is when people get the right education about modern pain science, like why do I really hurt? That's the first step. So the first step in reversing pain, or we also call it pain recovery, is one is, what is your belief? What is your belief about why you hurt? That's step one. Step two is fear of the pain. I cannot express this to you, as your first sign of success in dealing with your pain is fear. When you can learn to welcome the unwelcome, when you can actually recognize that, wow, this is so intense, and you're not over identifying with it. So meaning that when you have the skills to not be fearful when the pain shows up, because now step one, you know the truth, that's the belief. So it requires a belief shift, or I like to call it a cognitive paradigm shift. That means looking at things differently. The world is no longer flat, the world is round. That's a huge belief shift, right? And then we have fear. And you can learn, step two is learning to deal with the fear that shows up with the pain, which is really, really important. And it's a little bit technical beyond this conversation. But when you can learn to do that, it's the first sign of success. When your pain shows up and you're not grappled by it, you're not just kind of paralyzed by that fear, you can learn to actually move towards healing. The third part of reversing pain is emotions. Now, this is the part where people go like, yeah, I know this. I already work with a therapist, which is great. And we do want you to work with a therapist because sometimes you might have developmental trauma, some adulthood adverse experiences, things that really need some deeper work. But the third part of reversing chronic pain are emotions. Emotions play havoc sometimes. And we have dubbed emotions to be terrible, but honestly, think of emotions as like a check line engine that comes on. So when you can learn how to deal with the emotions, that includes thoughts, and the sensations in your body, and you can learn how to relate to it differently. Just like step two, fear, when you can learn how to relate to it differently. Emotions, here's what the latest science says. And the latest science says this, that when we do not express what needs to get expressed, it gets impressed in the body. So you notice I have a lot of silly sayings in each phase, right? The relief is in the belief. In stage two, the fear is the first sign of success is no longer fearing the pain. The third thing is that your relief will really come when you can really, really learn to express the unexpressed. Getting back to what matters. And this is kind of a hard part because when people are trying to get back to life, get back to walking, exercising, even bending down and doing some exercises, there's a lot of fear and a lot of emotions and, I'm going to hurt myself more. However, in the fourth stage of reversing chronic pain, what we want to do is we want to have gentle exposure. However, we cannot get there if you don't have the first three. Hence, it's sort of a layering, if you will, of skills. And when we get to the fourth part of pain recovery, it's learning to get back to life, but in a gently exposed manner, a step by step. And those skills will actually give you a chance to rewire the nervous system, or another way of looking at it, to desensitize the intensity. And when we can learn to kind of do things differently, think differently about your pain, no longer fear the pain, be able to express what needs to get expressed in a healthy manner, and learn to get back to life, you will realize that you'll start to flip the switch. And that is what we call reversing chronic pain.
I love it. And you're mentioning a lot of different skills that people can learn along the way. This is not just a theoretical application. Maybe we could jump into one of those skills.
Let's kind of just dial the nervous system down. How about that? Because all of this chronic pain, modern pain science says neatly with consistency now, it's the nervous system. It's less about structure, nerves, and tissue. And so with that said, let me think about this all right, let's try this. This is going to be kind of a different experience. If you just let me walk you through, let me provide you the instructions and then let's practice together. And this particular technique takes nothing more than 1 minute and 6 seconds. Arun, do you have 1 minute and 6 seconds?
I have a busy schedule, but I think I can make time for this.
That's
Sounds
great.
valuable.
So let's just do it. So let me walk you through it, and the audience is watching us. Take your right hand and place it over your heart. Now, with this instructions here is we're going to use your fingers. So we can call it the finger breath, if you will. If someone has a good name for this technique, let us know because we'll name it after you then. So the point here is to use your fingers and your breath in coordination. So let's practice this just with the thumb, because every single finger, we're going to do the same thing, okay? All right. So this is just for practice. So breathe in and then lift your thumb up. Pause. And as you breathe out through your pursed lips, lower that finger down ever so slowly. Good. Now let's move on to the next one. Breath in, index finger up, pause, slow sinking, melting, letting go breath, lowering that finger ever so slowly. Then the middle finger all the way up, breath in, pause, slow sinking, melting, letting go breath, just lowering that finger all the way down. Feel that sinking breath, feeling good. Next finger, whenever you're ready, all the way up. And breathing out slowly, lowering that finger, sinking, melting, letting go breath. And last one with your pinky, breath in, all the way up. And you should lower that, feel that sinking, melting, letting go, releasing breath. And before you completely open your eyes, now take the other hand and place it on top of that. So now you have both hands. And with a gentle press, just feel the rise and fall of your breath wherever it is. And as you're doing that, you may notice sensations in your body. And whenever you're feeling an overwhelming sensation with fear or pain, this is a simple technique to use. And also, this is a great technique as you press gently against your heart to send messages of safety. This helps rewire the brain. Taking another breath in, pausing at the top. As you breathe out gently, opening your eyes and then relaxing your hands. There you go.
Wow.
Messages of safety are written to the brain and the body.
I
So
felt my
there you go.
shoulders. I felt a lot of tension was in my shoulders. I didn't actually realize it was there. And then probably around the third breath, kind of just melted away. There's something kind of hypnotic about your voice as well. But
Yeah, it's kind of fun. Thank you. And I think what the really neat thing about all of this is to realize that we actually have the power within us to do this. And I think one of the things I hear, and I also was one of them, and we were one of them, people stuck in chronic pain, is to realize that, you know, we keep searching and searching for this holy grail. The reality is everything is here. And I think what we've done is we've just organized this, nothing more special than that. And in that specialness, if I may say that, is a sense of safety, because one of the hardest thing to do is to try to figure this out, whether you read a book and try to do things. And I think one of the most important thing is basically many of our members have testified that they have gotten better. I think it's important to do what matters and believe what you need to believe. I'm very big. I do want to say this to you, Arun, and to the rest of the audience watching and listening to us, is when I used to try to convince my patients that they could do this. Now I want them to convince themselves that they can do this, but it takes a lifestyle change to do that. And especially if you're struggling with lots of anxiety, depression, uncertainty during this COVID time, you know, with all of that stuff that's going on in our country, and then on top of that, you know, pain and family and work. Listen, if you're struggling, don't struggle. Let us help you. And Arun, I think I'm going to pass this on back to you. You know, I think we have something here that can help people. But most importantly, what my biggest gift to folks and to yourself is be kind to yourself when the worst happens to you. And you need to have skill sets. And the worst thing is not having skill sets and the right support.
yeah, I love that. That's a really great take-home message. On that, support, safety, one of the big ways that that happens, and there's a lot of science behind this, is doing things in a group of people who understand where you're coming from. Chronic pain can be very isolating. I know this from my own experience.
Yep.
When I started to realize that other people actually understood me and other people were going through the same process and same recovery journey, that was a really powerful moment. And we've tried to really do this in that vein, not to do this by yourself, right? As you're saying.
Yep.
We have a wonderful event coming up, which is a town hall. Uh, Les is going to be leading it alongside me. And we're going to talk about the 4 steps of pain reversal in more detail. And this is, again, for anyone who has chronic pain or suffering from aches and joint pains and nerve pain. Please attend. It's open to the public. It's going to be at 10 a.m. PST, 1 p.m. PST on September the 19th. That's a Sunday. We'd love to see you there. There's going to be a Zoom link for registration in the description as well as at the end of this video. If you have any troubles, definitely email us. You can email me at Arun, A-R-U-N, at remedypain.co, and I'll get back to you with more information and help you attend the town hall so that you can ask any questions that are coming up for you.
I'm looking forward to seeing folks there, and like I said, share this information with those who may be suffering, and let us guide you. Hope to see everyone there.